especially thanks to our U.S. Congressman Cuellar, to be here with his presence and all the authorities that are here. And diabetes is basically very frequent here in the Valley. Who has been complaining of some claudication, pain when they walk, also has been complaining of cold feet and cramps in the nighttime, and patient presented to the clinic with that, an ingrown toenail that has been associated with some pain and redness in the toes, and the tip start to turn black. Before going in detail about this patient, what is peripheral artery disease? In a simplistic way, is the narrowing of the vessels that carry the blood from the heart to the legs. This accumulation of fat tissue is called atherosclerosis, but it's important to remember that atherosclerosis is a systemic disease. When this affects the neck, we call it carotid disease and put the patient at risk for a stroke. When this affects the heart, we call it coronary artery disease and put at risk for heart attack and death. And when this affects the legs, we call it peripheral artery disease and put the patient at risk for amputation. Approximately 8.5 million of Americans suffer of PAD, or peripheral artery disease, and this number is increasing because of the aging and epidemic of diabetes and obesity. In this advanced stage, the patient is at risk for amputation. And unfortunately, around 185,000 of Americans suffer from amputation every year. More than 12,000 were performed in Texas in 2007. This increased to more than 16,000 in 2014. This is approximately a 30% increase, significantly higher than other states that they were approximately in the 8%.
Thank you. It's a pleasure. It's a pleasure. Dr. Pedro Mega, thank you so much. Those statistics were just amazing, what we're looking at. And again, I want to thank you for highlighting what you have done along with the other healthcare providers. And Kim, thank you so much for allowing me to jump over. Both of y'all, thank you so much for allowing me to come in and say a few words. I did not know what peripheral artery disease was. And again, this is why the education part of it, what we're doing here today is so important, because it's not only the education among the general public, but even among our healthcare providers also. Let me talk about a couple of things that we're looking at in Washington, D.C. And as you know, PAD is a chronic life-threatening condition, as the doctor said a few minutes ago, that leads to amputations that, in our opinion, can be prevented. Maybe not in all cases, but a lot of them can be prevented. And it does change about it. I mean, think about it. You lose a toe. Some people, he just lost a toe, no big deal. But it does affect you, not only health-wise, but mentally, when you lose a part of your body itself. Doctor, I think you made the point that Hispanic patients are especially at a high risk for this type of amputations that are caused by PAD. Recent study found out that Hispanic patients hospitalized for PAD are more likely to only receive care at the later stage of the disease. And again, therefore, more amputations because of when that help is provided. And therefore, among Hispanics, we see this greater risk of amputations. So it's critically important that we raise this awareness of this disease to make sure that, as the doctor said, we're underdiagnosed and undertreated also. And this is why it is important that we all work together to make sure that we prevent this type of disease and certainly amputations. Let me talk about a couple of things we're doing in Washington. Not enough, but moving forward, and certainly want to talk about some of the steps that we are looking at. You mentioned there's different things, exercise, some of the modern medicine where you can open up and clear up those veins. But let me talk about one part of it, medication, and how expensive it can be. We passed a bill some years ago called the Inflation Reduction Act, which was signed about a year ago. And this does a couple of things. One, it would allow Medicare for the first time to negotiate prices for some diseases, where it's cancer, heart diseases that we have, and so many other things. One of them also includes Serraletto, which is one of the medicines that's used to treat this PAD disease. It's treated for blood clots and, of course, reduces the risk for patients with PAD. This drug costs an average of $4,511 per patient last year. And there are over 1.3 million Medicare Part D patients that use this drug, use it on a yearly basis. So the ability to give Medicare the ability to, should I say, to negotiate prices for lower prices, should I say, over 10 different medicines is going to help a lot. This will result in lower out-of-pocket costs for patients, not only for this PAD disease, but also for cancer and other areas. If everything goes fine, as you know, some of the what are called the big boys, companies are fighting, taking this to court. All we're saying is just negotiate, use the power like we do for the VA, the power of the government to get better prices. That's what we're doing. That's all we're doing. We're not saying give it away free. We're not doing that. We're just saying, hey, just like they negotiate with anybody, just negotiate a better price for people that can afford it. If we're able to do that for those 10 medicines, and they will go in effect in 2026, and then we're hoping that we can start off another set of negotiations so we can keep bringing down the prices. This Inflation Reduction Act, not only did it give Medicare the first time the power to negotiate better prices, but it does a couple things also. Insulin costs are capped at $35 per month for Medicare patients, free vaccines for shingles and Tdap also. Out-of-pocket maximums of $2,000 per Medicare Part D. And again, lower out-of-pocket costs for the sickest patients, like patients with MS or cancer, who would no longer be able to pay when they reach that very difficult cost phase that we have. So this Inflation Reduction Act that we passed is going to be important, not only for cancer or other, but especially also when we talk about this medicine that's used for PAD, it would help that. So again, one step forward that we're taking. In Congress, again, I've co-sponsored the Amputation Reduction and Compassion Act that, as you are very familiar with. I need your help to get other people to support it, because if you ask people generally, they'll say, oh, yes, I'm there. But will they put their name and vote on it, which is more important? Saying one thing is one thing, but actually putting your name and voting and supporting it is very important. So I need your help to make sure this is not a Democratic or Republican issue. It's doing the right thing for people that need help. This bill requires Medicare and Medicaid to cover preventive screenings for higher risk individuals so PAD can be caught and treated early, as the doctor said a few minutes ago, before it leads to any amputation. The bill also requires the Department of Health and Human Services to develop a pilot program to support amputation prevention, including early screening and treatment for PAD itself. In the appropriations, as you know, I sit on the Appropriations Committee, and I'm working to see if I can get some language. I found out one thing in Washington: either you can pass legislation or you find a train that has to pass every year. Sometimes a little bit late, but it's called the Appropriations Bill. It has to pass every year. And I'm working on some language to create a PAD education program at the Department of Health and Human Services, so doctors are more aware of the symptoms of PAD, so cases can be diagnosed and treated early. We're hoping that this program will develop and implement also strategies to inform the public about this disease treatment and prevention. Using the power of the federal government, we're hoping that this program can focus at-risk populations, as the doctor so well said it a few minutes ago. By increasing awareness, I think we'll be able to treat cases as soon as possible so we can prevent some of those amputations. So again, there are challenges, there are resources, there's educational, there's outreach that we're doing. The steps that I want to take along with my colleagues to take those steps that I've talked about, one step to get there. So whether we negotiate better prices for medicines so people can afford them, or we provide money so we can start off pilot programs so we can educate people, those are the steps that I want to take forward working with my other colleagues.
And since inception in 2019, actually September 4th, 2019, we have saved nearly 1,000 limbs of patients told that they had absolutely no option. Options are available to save limbs, especially if we catch it early. And that's really the key with the ARC Act that the congressman was mentioning. We need to get people diagnosed sooner. 3 in 5 people who suffer a heart attack have peripheral artery disease. If only a doctor took 2 seconds and 2 fingers, 2 seconds, 2 fingers to feel the leg pulses, life and limb might be saved. We have a patient that is right here in the valley that I support. The daughter's name is Esmer Garza, and she phoned me from her dad's side in the hospital room here in the valley on August 7th. Her dad was up for a transmetatarsal amputation, meaning a quarter of his foot gone. Something that could have been prevented. But at that point, it was too late to save that part of his foot. His journey began with PAD in January of 2023. He ended up presenting with a couple of sores on his toes that would not heal. His primary care physician sent him to the podiatrist, who said, oh, here's some iodine, put some iodine on it, keep it dry otherwise, and here's some antibiotics. He went back and forth to the podiatrist multiple times over the next 6 months. But suddenly, by May, what do you think happened? His toes started turning black, 2 of them. His foot went cold. He goes to his primary care physician and says, what's going on here? Why are my toes turning black? Why is my foot cold? And the primary care physician said, well, 1, I think you have some arthritis, and 2, I think you have some toe fungus. You need to go back to the podiatrist. He goes back to the podiatrist, finally gets an appointment in July. This was May. In July, he's finally able to get in and get an appointment with the podiatrist. And the fellow who was with this podiatrist said, oh, wow, I think that's gangrene. To which the podiatrist replied, no, that's just dried blood. August 4th, his daughter Esmer came to visit him and said, what is going on? By that point, 4 of his toes had started turning black. She ended up doing a little research on her own, found the Wound Care Institute here in this area, and they said, get him to emergency right away. And that's when he was on deck for amputation. They did try to open up some of the arteries, but as with so many physicians across the country, they do not unblock arteries below the knee. They say it's just not worth the time. How many of you have seen Deion Sanders' video on YouTube and on Instagram, where his doctor said, well, we could open up those arteries, but it's really not worth the time. Why delay the inevitable? It's just gonna close up. We might as well just amputate. I hear this every single day, not just here. I hear this around the world because I'm on the front lines with these patients. It is possible to treat below the knee. It is possible to open up those small arteries. Your arteries are not too small to treat inside the foot. They can be treated. It is what we consider a subspecialty of vascular. It's people we consider CLI fighters, critical limb ischemia or critical limb threatening ischemia. CLTI or CLI is the most advanced stage of PAD, and we call those doctors who exhaust all efforts, every tool, every technique to save a limb, we call them CLI fighters. Dr. Mego is one of only 10% of doctors across America that exhaust all efforts, learn these advanced skills to open up the most fragile small vessels below the knee and into the feet. That's where the weight of my heart comes in, and we navigate these patients told that they have absolutely no option. We navigate them to doctors like Dr. Mego. They're so lucky to have him here. There are so many medical deserts across the country and around the world where doctors like him are not available. And we pay for transportation, we pay for plane flights. I flew someone from Cape Town, South Africa, clear to the UK to get not only limb-saving care, but life-saving care. We need more incentives out there to get more doctors trained in not only what is PAD, but the advanced treatment for PAD, and to give up the patient to those doctors like Dr. Mego, who actually will exhaust all efforts to save life and limb. The ARC Act is so important. I don't think it goes far enough. I think that just simply a vascular assessment prior to amputation is not going to solve the problem, because they can go in and they can do a CT angiogram and still tell the patient that it's not possible to save the leg because they can't treat. It's not worth treating below the knee. It's not worth opening up those arteries. You do not hear an oncologist telling a terminal cancer patient that it's not worth you living another day. It's not worth you trying this experimental medication. It's not worth exhausting all of my time and my resources to give you just one more day with your kids, with your 3 kids, to give them that one more hug that they need. But you know what? They don't give that same respect to a CLI patient. And that's where I come in, and that's where collaborations such as this and bring these 501c3s together, bringing the entire community together, is literally going to be what moves the needle. Let's save life and limb together. Thank you. Thank you.